Good day, everyone. Welcome to another episode of the Seco Direct podcast. I'm your host, Dr. Tiwa, and I am always your guide to all things heart health. Today, we're discussing a very crucial topic, arrhythmias in heart failure patients. Now, if you or someone you love has been diagnosed with heart failure, you might have heard about the risks of irregular heartbeats. But what do these arrhythmias mean for the prognosis and, of course, for treatment? And most importantly, what can be done to manage them? Let's break it all down to simple terms. Stick around, you won't want to miss this. So let's start with the basics. Heart failure happens when the heart is too weak to pump blood effectively. Because of this, the heart tries to compensate, sometimes leading to electrical problems, aka arrhythmias. Now, the two most common arrhythmias in heart failure are atrial fibrillation, which is the upper chambers of the heart beat irregularly, making it harder to pump blood effectively. Now, of course, we have the atrial chambers and the ventricular chambers. So when the upper chambers are not beating properly or they are beating irregularly, that's where we have atrial arrhythmias. Now, we already talked about the atrial chambers. When we come down to the ventricular chambers, when those chambers are not pumping blood or giving the correct heartbeat, they are called ventricular arrhythmias. Fast erratic heartbeats from the lower chambers, which can sometimes be life-threatening. Now, when arrhythmias develop in heart failure patients, they can make things worse by further weakening the heart and increasing the risk of sudden cardiac arrest. That's why managing them, it's very, very important. Because what do these irregular heartbeats mean for them, for people that have heart failure? Well, it means that you have to look out for the type and the severity of the arrhythmias that might occur in a patient with heart failure. Now, why are these arrhythmias dangerous? First of all, they reduce the heart's efficiency, because if the heart isn't beating properly, blood and oxygen does not get to the body as they should. Secondly, they increase the risk of stroke. Atrial fibrillation, for instance, can cause for blood clots to travel to the brain. 3. They can trigger sudden cardiac arrest. Ventricular arrhythmias like ventricular tachycardia or ventricular fibrillation can be deadly if left untreated. But the good news is that with the right treatment, these risks can be reduced significantly. Doctors have several ways to manage arrhythmias in heart failure patients, but here are the main treatment options. Number 1, medications. What medications are we talking about? Beta blockers and ACE inhibitors, because they help the heart work more efficiently and reduce strain. Secondly, we have anti-arrhythmic drugs. They are used to control irregular heart rhythms, but only when necessary. Thirdly, we have blood thinners, quote unquote, they're called anticoagulants. Now, if atrial fibrillation is present, these can help prevent blood clots and also prevent strokes. Another thing that is typically used are devices. Devices like what? Pacemakers. They help control slow heartbeats. We also have implantable cardioverter defibrillators, ICDs. They detect dangerous arrhythmias and deliver a shock to restore normal rhythm. We also have what is called a cardiac resynchronization therapy, CRT. It helps the heart chambers beat in sync, improving the efficiency of heartbeat. Now, what are the procedures that can also be used to help heart failure patients deal with arrhythmias? We have what is called a catheter ablation. Destroys abnormal heart tissues that are causing the arrhythmia. Now, we spoke about the medications, the devices, the procedures that can help patients with heart failure deal with arrhythmias. Now, what can you yourself do in terms of lifestyle changes? You have to reduce your salt intake. You have to manage your stress effectively. And you also have to stay active within safe limits that can help manage your heart failure and manage the arrhythmias that are attached to them. Now, if you or a loved one has heart failure and arrhythmias, Here are a few things you need to do to stay on top of your health. You have to monitor your symptoms. Report things like dizziness, fainting, or irregular heartbeats to your doctor. Take medications as prescribed because they are very key to controlling your symptoms and preventing complications. You also have to follow up with your doctor regularly because heart failure is a condition that requires continuous monitoring. And finally, you have to know when to seek emergency help. If you experience symptoms like chest pain, extreme shortness of breath, fainting spells, call for help immediately. Many heart failure patients live active, fulfilling lives with proper management. The key is early detection and treatment. Now, arrhythmias in heart failure can sound scary and are scary, but with the right treatment, they can be managed effectively. If you or a loved one has heart failure, stay informed, follow your doctor's advice, and take control of your heart health. Thank you so much for joining me today in this episode of SecoDirect. If you have found this episode helpful, share it with your friends and family. You don't know who requires this information to stay alive. Now, don't forget to subscribe to more heart health discussions. Until next time, take care and keep your heart beating strong.